Good morning, everyone. I would like to take this opportunity to go ahead and kind of lead this discussion. Yesterday, we had a wealth of knowledge and information coming from each of you, each so significantly potent that I know that anyone who hears the information will be transformed. Each of you have given us ways of reimagining ourselves, how we see others, how we engage with others. And we recognize that healthcare is or should be just like any other care that is delivered. Right now, what we see is kind of a reactive approach to healthcare. And what you've brought is an understanding of where it begins and how we can recognize events and activities that may seem harmless today, but may actually be building highways to a mental health state that will not necessarily be helpful or functional. We do recognize that in society today we have hundreds actually of different mental health diagnoses. And I did not go home and diagnose anyone, but you can understand now why certain behaviors exist and can be more empathetic in terms of response. To the topic of today, really to help persons to understand the effect of mental health on performance. I thought to myself, you have some functional madman out there, or mad people out there. So a mental health diagnosis does not necessarily negate a person from being gainfully or responsibly engaging. Miss London, England, and Rome. Miss Fagan, England, yesterday pointed out burnout. And as a nurse, I've suffered 4 burnouts in my life. And after the last one, my doctor actually helped me to change the way I approach. But, she didn't go in depth like we did yesterday. But she looked at what is your day like? And then she literally prescribed some changes for me, such as working X amount of hours per week, drinking X amount of water per day, including more of such and such foods in your diet, making sure to rest. And even, she said, even if you do not feel like you want to sleep, get in bed, turn off the stimuli. And that helped. And as I embarked on private healthcare education, I got into the space of mental health. Because if you look back on Facebook or Instagram, you'll see 9-10 years ago, I began hosting mental health seminars, recognizing mental health conditions in teens. I've had the opportunity to work with Ms. Sanguinetti on other mental health projects where, to my amazement, based on the discussion, we should really be in a position where we're recognizing mental health conditions from age 2, as soon as they're able to talk, as soon as they're able to express themselves. And this, I'm going a little bit off topic here because as the thought comes to my mind, I just want to speak it. In healthcare, we have screenings. You go to the doctor, They don't care why you're there. They do your vital signs, basic. And as I said, this is a little bit off topic, but should we be including a mental health screen in healthcare on your regular doctor's visits, on your clinic visits, when you are bringing in your children for well baby clinics? That's my first question. Please. I don't know who wants to take it.
Sure, I can take that. Like,
okay.
yeah, I think it would be helpful to do a screening early on, both. And I mean, as I said in yesterday's presentation, I don't personally hang my hat too much on to obtain a diagnosis, but maybe more to have a baseline of how someone is managing and coping. Mental health is still very reactive in that most people that I've worked with, again, are not seeing a therapist unless they've found themselves in crisis. But almost maybe 100% of them have seen a doctor, have seen a nurse, whether it's for maintenance or something like that. And I think as the conversation begins to shift around looking at mental health just like we look at any other health, something that is just to be maintained, not to be managed when there's a problem. In order to do that, there has to be some form of assessment, right? So, and for young people, maybe it's not as in-depth, but just seeing how they're functioning, how they're managing, some of the discussion that happened yesterday with ACEs. I think some of those things, as early as you can identify them, would be really helpful, because I know from my work experience, which is primarily forensic in mental health in corrections, there's a direct path from things that we see in schools as they're progressing. So if we can catch those things early and invest in support or even just awareness for the individuals or the parents or the families, then we can probably avoid, having people's first experience with mental health being a prison or a group home or something like that. Or a breakdown in public, absolutely.
Yeah, on the topic of... I'll use this one. Okay, yeah. Yes, it is reactive, I agree. And I do believe, just as you would see a physician and they'll ask about family history, I don't remember seeing that on the checklist. If there's a family history of mental health, they ask for everything else, diabetes and all the other morbidities, but I don't recall seeing mental illness. And yes, awareness. I need to reiterate what Duane says about awareness and starting it at an early age. Just as we get health education in schools, we should get mental health education. So at least people can identify if there's anything, strange, different, off, and maybe they don't know how to name it or what to call it, but at least they can identify it at an early stage and then seek the right support. So yes, certainly I do believe that it should be addressed in that way.
I very much agree. You can hear me, right?
Yes.
And I think the other thing is some of the questions, if you just ask somebody, is there a history of mental health in your family, they might be ashamed. And that's a lot of the reason why people don't do anything initially, right? Is because of the stigmas that we've placed on this. And so I think if there is some sort of screening, it should be done mindfully, and maybe you don't ask them, is there a history of mental health? Mm-hmm. You ask them in other ways, mm-hmm. so that they don't necessarily know that that's what you're getting at, because the shame is a large barrier to absolutely everything, and it's one of the biggest issues. And so there are some vital signs that you can use to also predict this, right? Mm-hmm. Some of the questionnaires do ask, how many alcoholic beverages do you have per week? I remember when I was younger going in and putting what's wrong with writing 25? What's wrong with writing 50? I didn't know, right? So I put as many, right? But I know it's changed now. I barely even drink alcohol, but if I was still in that period of time and I knew that you were asking me a question for a specific reason, I wouldn't have written 25 a week because I didn't know that that was an indicator, right? I don't want you to label me in the system because I know it's going into the computer. And I moved from health and then into IT, so I know where all of my data is going. And people specifically in that arena who know what's happening with your data and how it's being amalgamated to then, classify you, and you can't scrape that, right? So I might not want to be labeled a certain way, and so I think if we were going to do it, we need to do it very mindfully. And you can use some vital signs as predictors of if there's something going on with behavior. So, yes.
Test. I just wanted to add something. Just thinking about the shift that happened as a result of the pandemic, and when I think about everybody at the time, if you had a sniffle, people thought they had COVID. But I think what I found was really interesting, especially I noticed with my children, was they became really aware of symptoms. So instead of my kids getting up, which I mean primarily it was to avoid school, and saying, "Dad, I have COVID," they knew the checklist that we were following of if you have A, B, and C, you're probably going to get to stay home. And I think if we educated our young people a bit around mental health, again, so not necessarily diagnosing, but so that they understand what symptoms are. Like my daughter as young as 11 we've talked about things like anxiety. Typically it's when she hasn't prepared for a test and she's like, "Oh, I felt this thing, I wasn't breathing." But I think I'm not labeling that for her. It's not necessary. But, giving her education to kind of figure out, is this nerves or are you dealing with anxiety? So I think allowing the children to be a part of that as well, to know this, have you felt this? Have you experienced this? Are you telling your mom, your parents, or your teacher? Will just kind of allow us as maybe the health professionals or as parents to kind of look and say, okay, when they meet this criteria, then we're going to follow up. Similar to what we did with, COVID, right? When people had X, Y, Z, then maybe you're doing a test, or maybe you're going, just staying home or isolating.
Thanks. I'm going to take off on just where you left off with regards to knowing the symptoms of a person who may have mental health and in educating our population, individuals. Now, I'm going to play the devil's advocate and go on the side of the employer in this way. How do we prevent abuse of mental health conditions and by persons feigning mental health illness just by knowing the exact same thing and saying the right thing, and us having empathy about persons who may have mental health challenges at work and say, "Oh, maybe they'd be like Simone Biles, I'm not feeling well. I'm going to take care of my mental health today. Take the day off." Is it really the case? And how would that change now for physicians? How many physicians will be willing to write a sick certificate for a mental health break, a day off? We don't often do it, but I think that's something that I also considered how you discuss that. How do we change that culture? All right, that's a few things to ponder on.
So I wouldn't mind taking that one. I think, again, this is an example, and I've been in positions of overseeing people, or you still have to operate as a leader, as a manager. But I think this is just another example of the stigma around mental health, because I could pick up the phone and say, "I don't feel well, I'm sick." And how do we currently manage abusing that? We don't. You take people's word, unless it's a significant illness that a physician can diagnose. So I think it's the same difference. Like I don't really have the recipe for the people who are going to abuse the system and lie, right? But I think I just feel like there's so many other areas of abuse. So I guess the same protocol that we would maybe use to manage someone who's just calling in sick is let's just use the same criteria. in some cases, as a manager, you just have to accept that if the person's calling and saying that they're not well, they're not well. When it comes to, I think also morale for people, as someone who works in a high-stress environment, I work a lot with nurses and social workers in a prison environment. If I need a day off and you're getting stress from your employer, given the workload, I think the impact of morale, which kind of goes to the question of the impact of mental health and performance, that morale at work and feeling questioned and unsupported has a huge indicator or it could be a huge precursor to burnout down the road and people's performance. And so I think it should just be consistent, health-wise. And I think we have to accept that in some cases, we may not be able to know 100% if someone has a diagnosis. But at the end of the day, I think we need to trust that, people get up and go to work, and in this field, there's always going to be a few that are abusing. I think in the extreme cases, it'll be clear, just like with physical health. So if someone experiences a terminal illness or something, you'll have documentation, you'll have the proof. Similarly, if someone's managing a significant, major mental illness, you'll probably know because it'll be clear as well.
Yeah, I totally agree. This mic just doesn't like me. I really agree with Duane. I mean, I share the sentiments. It's hard to monitor. How do you have to give them the benefit of the doubt. Just as someone will say, I'm not feeling well today, I can't go in. We just have to give it some validity and just trust them that they won't abuse it. And as Duane says, if it's extreme, you'll know. You'll know if they're having a mental breakdown and it's extreme. You'll kind of know. So it's so hard to monitor that. And I mean, there has to be criteria, of course, in terms of assessing whether somebody is actually having a mental health issue. And policies can be put in place without making it too stringent. The thing with policies is that sometimes they work against people, and then people can't get to tell the truth. And you want people to be honest, but the policies sometimes can make people lie. That's where I find it. It makes people want to tell lies. So make it so that people can be honest and open, and maybe they just will be.
This is also something that I've thought about quite a bit. So, because I believe that the nature of the way that we work today doesn't really allow people to take the time that they need. You have to come 5 days a week. I mean, in the system that I came from, you have to come 5 days a week. You only get 2 off. And in those 2 days, you have to wash your clothes. You have to make sure you're presentable for work. If you don't show up presentable, then nobody wants to talk to you. And apparently, you're some kind of recluse. And then if you're trying to eat healthy, you have to also make sure that you've bought your food in that time. You have 2 days to do all of this. Imagine if you have children. Imagine if you have other things to take care of. And then on top of that, we don't really teach people the tools to deal with an emotion immediately. And so sometimes I think the backlog of that emotion can come up on a Tuesday when you're sitting at your desk. And maybe it's the way that we work can be slightly reimagined as well. That, if you're a healthcare worker, yes, you go there and you have an 8 or 12-hour shift, but maybe there has to be some sort of pod a literal pod that's put into the hospital for a nurse to go sit in that has relaxing music for a moment in the day. And that could help them with, maybe they have a journal or something that they can just get out their emotions for that second. And then they don't necessarily have to wait until they have to take a day or 2 days or 5 days off. And I think if someone is abusing the policy and they're lying, then that's a mental health issue. So if you can't show up and be your natural self every day, I think that there is something to be said for that too. And so I think if we find that people are abusing it quite often, then I think it's also a restructuring that we should talk about. But in my opinion, I think the way that we work isn't necessarily working. And so what I used to find was that as I was, another personal story, but as I was going through this process of reprogramming my brain, I was working in a corporate job. I was doing 3 people's jobs. I was doing them all very well, delivering on time. And if I needed to take 20 minutes because I was having some sort of moment, I still was delivering 3 times more work than the person next to me. So the question that sometimes I have is, if I can still deliver my work and I can still do it better than everybody else around me, what does it matter if I take an extra day? Because for a lot of people, the same chemical that's involved in you being a good worker is the same chemical that's involved in you getting into a mental health crisis. So it's the same neurotransmitter. So sometimes it's the best workers that aren't going to tell you, and it's not really fair that they're being kind of like scrutinized. So that's just kind of how I think about it.
Thank you very much for that. I do have a question. What happens when it is the manager, the leader, who is the person who is having that mental health issue, and it's filtering down through the work structure? What happens in such a situation? The head can't lead effectively. What happens then?
How far of head are they? How many levels up is this head?
We can go as far as you'd like to, as high as you'd like.
I think it's important that all people know exactly what the signs look like, because in theory, the community should be able to recognize and be able to approach that person, right? If you have enough people, but if everybody is not aware and everybody is scared and everybody is people-pleasing, which from yesterday we saw as a big sign of not taking things into your own ownership, then you can't address that person either. And so if you just address them one-on-one and they're not well, they might penalize you. But if you have multiple people that are able to come together, then that could create some kind of change. And so I think this idealization of people that comes with trauma, we need to maybe stop idealizing the person that is in this position. They're still another human, right? So that would be my take on it.
Yeah, I believe that there has to be space for management, for the managers to also have some downtime. Give them time to decompress. When you're managing a workforce, it's not easy. And I'll give you a quick example. I teach 24 hours. My student population is over 100. At the end of the semester, I have 2 days in which to upload grades on a system, grade papers, and we're talking about papers that are sometimes 10, 20 pages long. And I've only been given 2 days to do that. That's crazy. I'm like, I'm just going to pass everybody. Well, no, I'm just joking. But, it's, so it's like, I remember just recently, the semester ended and I was grading and I just went blank. I just threw down the paper, went downstairs, had a glass of wine, and I'm like, when this is done, it's done. And certainly I was not ready until the day after, because I was feeling burnout. So again, in my capacity as an educator, that also, educators, we don't get the right treatment sometimes, and that's where sometimes the mental health issues come up. Leaders, managers, teachers, nurses, they need a mental health day, if you ask me. They need a break. And to have a wellness program, I believe. I'm all for wellness. I'm a certified health coach, health and wellness coach, and wellness is huge. We need to start making wellness part of HR. It has to be a part of HR systems so that managers, employees, at whatever levels, whatever tier, so that they can get a mental break too. Because it's hard being a worker. It's just hard, right? And I've been doing this for over 35 years, so. Oh, yes.
Thank you.
My mic's dead. A couple of points to that question. I think we need to, again, I'm going to be a broken record. We need to normalize talking about health. So, for example, I was blessed enough to be able to play college basketball for years. I've been very active. Over my sports career, I've had 2 major knee surgeries, torn patella, torn ACL. Overall, and I'm sharing this, there's no stigma attached. Yesterday, I went to the market for the first time, walked around, and my knees are hurting. So as a result, today, unless there's a car involved, I'm gonna take a day. We need to get to a space where we can have those conversations about mental health. It's a health issue. I'm sharing it. There's no shame in it, right? So if I deal with anxiety, and let's say yesterday I did a talk and it was really stressful for me, and it took a lot for me to complete it, which might be half true, to be able to share, yeah, yesterday was a tough day, so I'm taking a day, whether I'm a leader, whether I'm a manager. If we just normalize the conversation, it's just a health thing. If it were a physical health problem and I was at the top of the chain, and I needed to take days off because I just did chemo last year or had a back surgery or whatever, no one would blink an eye if I took time off and shared I'm taking X amount of time because of this health issue. And as long as we refer to mental health as some other thing that, some people either need to keep secret due to the stigma, is where we have this situation where, as a manager now, I feel like I need to qualify this time off, right? Or I need to figure that piece out. I think we just need to start being very open and having these conversations, because we're just talking about health, right? It's one component of health, but as long as the culture of the area has some stigma attached to it, then we can't have that. So, when I worked in, as a therapist in a prison, when we were going through an inquest and things were stressful, for the chief of psychology to say, I'm taking a week off, I'm feeling burnt out, among our group, that was not something that anyone looked at as a negative. But if I stepped to, when I was a correctional officer, there's a different expectation if the manager is like, I'm taking time. That incident yesterday required me to take time off. So I think that's a big culture thing that we just need to be able to have these conversations in another space where we're not feeling like we need to hide the fact that, maybe we deal with anxiety or depression or any of those sorts of things. Like, they just need to be normalized.
So would you say then that image and ego stand in the way of persons who are going through mental health breakdowns actually seeking help?
I'll say no, because image and ego then puts it on me. Maybe it's the culture. That's what I mean. It's all of us, right? So it's maybe there's some embarrassment, but I think that's one thing that we look at is it's not my ego per se, right? If it's fear, if I'm scared that you won't respect me.
As the manager and the leader now.
Even as the leader, I think it then is putting the onus on me to, Duane, get over your ego and just tell everyone. But if the culture is such that that's not a safe space, then I can't do that. So the example I gave of being a correctional officer versus speaking to a group of therapists and saying, I'm burnt out and I'm taking time off, I think we need to make it a community issue, not this individual has ego. You get what I'm saying? And I don't know if that makes any sense, but if it's a culture that you can just say, I deal with this, and everyone in the room, if the majority of us accept that, and let's say Charlene is the person who's like, oh, look at Duane, and if the norm is that people are like, why are you making fun of Duane because he has mental health issues? Like, that needs to be the norm, that person is the outlier, that you don't minimize mental health. I think that's the shift. In my experience, that is why, like, the stigma related to mental health, that's why people isolate. It's because then it's put on you. If you think of the examples of the questions that were brought up, rightfully so, but thinking, questions around, well, what if the person doesn't identify that they have an issue? What if the community is not such that I can feel safe to share that, right? Maybe if we just create a norm, because you could walk in any day and say, I have a cough, I have back pain, I have dealt with, X, Y, Z, but there's different expectations of the culture, and I think as you go through different, organizations, you might find that culture is different depending on where you work, right? So maybe a group of nurses are more likely to speak openly about that, but if I'm in, let's say, a political position where there's an image of leadership, and maybe that's looked at as a weakness, I don't have that safety. So I think we just need to shift the culture. Not just like it's a small thing. It's one of many things that we could do is start to change the conversation. And going back to that first question, that starts with kids, right? If my children grow up in a culture where we also talk about mental health and anxiety and depression, and like my children know I've switched careers partially because of burnout. Like, I didn't like the job, didn't like working in a prison, decided to go private. So now they've started to understand that, hey, if you don't love your job, maybe there's things you can do to change that. And so I think we just, shifting the culture now, but also the education for young people is also a big piece of it.
But to add to that, I think it's a little bit of both, because ego does contribute quite a bit. When someone goes through trauma, their self, there's a, in Freudian terms, there's an ego and a self, right? And so you've got your true self, and then if you've gone through, let's say, one type of trauma, it's going to fragment off into what is called then practically by society today an ego. And that ego creates a personality to protect you from whatever might be coming up at that time. And so once you notice a relatively similar stimulus come in again, then that version of the ego is going to take over. And so if someone's gone through multiple different types of trauma, imagine the number of egos that can surround the true self that's in the middle. And so there is a way to speak to ego, but it has to be trained, and we're not trained. And so I think it's very important to understand how this might happen in someone, so that when it's happening, then if all these people work for someone that they notice this is happening in, and a lot of times just working to get to that position, it couldn't be ego-driven action. So over time, I think as the population knows, they can start to address it, but you can't just go up to somebody and say, you have a big ego. That's going to activate their ego. It's going to activate a defense. So you need to know how to talk to the ego. And I think if enough people in society know how to talk to the ego, we create a domino effect in a direction that eventually dissolves ego. But if we don't create that domino effect, then it gets worse and worse, because now we're still just multiple people who are hurt, going out hurting multiple more people, creating more ego, creating, so we're either going this way with the funnel or we're going that way with the funnel. And so I think it is a community thing, because once we get the domino effect, but the domino effect comes from you have to start with understanding ego.
Very good. Thank you very much. I invite questions from the audience.
Yes, good morning, panel. Thank you so much for your presentations yesterday. I found them very enlightening and informative. In particular, the presentation talking about Black mental health, racial stress and trauma, something that many don't think actually exists, and in particular, intergenerational trauma. So I guess maybe I'll start with a story before I get to my question. So it's the story of my great-great-grandmother, Anne Marie Jackson. So she fled the United States in the mid-1800s, fled slavery. This was a time when there were things like the Fugitive Slave Act. You could be killed if you left. And she did that with 7 children under 16. So speaking of intergenerational trauma, we know that our ancestors lived through us. We heard about the legacy. I'm just curious, from your perspective, any specific treatment interventions that you find more helpful when we're talking about generational trauma, as well as the competencies that clinicians need to have to treat generational trauma? Lots of Black therapists, coaches, and counselors are stepping up now to say, I want to help my community, which is fantastic. I'm one of them. But that doesn't make us competent because we're Black. I think it's good that people are wanting to engage and help, but you have to be skilled to deal with trauma. So I just wanted to know your perspective on that. So again, the competencies and then specific treatment interventions for generational trauma.
So I think personally, I don't really sign up to one particular treatment intervention, and we hear the term Afrocentric thrown around quite a bit. It's not a thing, it's kind of more so an approach, right? So, the idea of Afrocentrism is the centrality of the Black experience influence from the continent of Africa. That doesn't mean that the contributions, let's say, to healthcare that are happening among Jamaicans are not Afrocentric, because historically there is a connection to Africa. there are similarities in how, I'm just going to say Africans or people of color. There's some similarities in how we communicate, how we operate in the world. And I think, so a Black therapist who wants to get engaged in intergenerational trauma, I do see there being value in what we call evidence-based practices, CBT, all of those. However, I don't think that they are a one-size-fits-all. I think that there's an integration of how do I make, let's say, something like cognitive behavioral therapy fit for, the person like me who's, let's say, born in Canada but identifies as Ghanaian because my parents made sure I had my African culture in my life. And similarly, if I have the person who is sitting in front of me who just emigrated from Jamaica, there's a learning that has to happen from between the clinician and the client. And then the skills and training that you have, in regardless of whatever modality, I think the openness to considering the impact of, racial trauma on the situation, right? I think that both Black therapists and white therapists could effectively support someone to manage intergenerational trauma. It just comes from an openness to learn. Think a few modalities that I'll say, I can say are at least rooted in Afrocentrism, the Tree of Life, and I think that we all, I hope can agree that lived experience is a big piece of, the experience of Black people. And as we talk in this room, I have not seen anyone not share something and not start with their personal experience. So that's a commonality, and we have people from all over. And I think with Tree of Life, because it is a narrative therapy kind of approach, your role is to help the person tell their story, and you're just a part of them thickening that story. So that past story, and then you guide them down rewriting what the new story will be, right? And I think that's the piece that we miss if we just are stuck with an evidence-based practice that's very rigid. 12 sessions, you talk about this, you talk about that. I think it just needs to be a mutual learning, if that makes sense. There is a new modality coming. I just haven't written that book yet. A couple years.
Yeah, I'd like to add to what Duane says about using different approaches, and an integrative approach is best. I love, in particular, the Tree of Life, because it allows you to change a story. We all like to say things like, oh, it's remnants of slavery, and it is. It has validity. Slavery has really messed us up. But how do you shift that? How do you change that mindset? Do you sit there and say, oh, I'm Black, my grandmother, my great-grandmother, they were slaves or, descendants of slaves? How do you shift that story? Another thing is understanding culture. In Canada, there is this perception that because we're all Black, we share the same culture. I've said in workshops that you can't assume that because a Black person comes into your space that you're going to use the same treatment. Jamaican Black is different from Nigerian Black, is different from Trinidadian Black. Yes, there may be a shared history, but there are distinctions to our culture. I know coming from Jamaica, we tend to be resilient, a word I don't even like anymore because it's too much burden to be resilient all the time and to always show up strong. So we're all enduring. I've kind of changed that word to endurance. We're all enduring. In North American space, we're there, and someone will see me and they'll say, oh, where are you from? And they'll automatically assume, obviously, a Black country. They'll say Nigeria, they'll say Ghana. In therapy, I think it's important to allow the person's culture to come into play. We call it cultural safety, because there are practices that are unique to each culture. Like I said, from Jamaica, we don't necessarily share some of the same practices as people from Africa. I work with a Nigerian, somebody from Zimbabwe, and we all work together in a space where we are the minority. But when we gather, we are learning so much about each other's culture that is unique. Yes, shared experiences. We call ourselves the Black team, privately, of course. if somebody else is hearing right now. But we enjoy sharing, about each other's culture. So in therapy, I think you can't use a one-size-fits-all approach. It has to be unique to the individual, and culture must be considered.
Thank you so much.
You're welcome.
I'm happy to add. Specifically in terms of the brain processing the information faster, you have to learn to retrain your breathing rate. And so it starts with knowing how to hold your tongue in your mouth, specifically how to reprogram your system, because one of the issues with the generations of slavery is that you're constantly being hit, which reactivates your stress response and then makes people hyperventilate. And so most people in this culture are hyperventilating and they don't know. And that hyperventilation makes it really hard for them to stand up in any space and say, this is my experience, right? And I think the goal of all of this is to get out of, like you're saying, like to get out of yes, this was my history, there was slavery in my history, but today, and I think this is also sometimes where the mismatch between the Caucasian population and the Black population having this clash of heads. They're like, but I'm not the one doing it to you. And it's like, yes, I know, I understand, and we are technically all trying to go towards the same goal, right? We're all trying to go towards equality for everyone, safe places for everyone, acceptance, but there's a communication problem happening. And it's really hard for both sides to speak their piece, but specifically for people who come from this background is like a re-traumatization of even trying to speak your piece, right? So how do you get to the point where you can speak your piece? You have to really train your breathing rate. That's the first thing. And then once you do, you can go in and then you can rewrite the experience a lot easier, because if you just visualize a new experience, it will trigger your stress response also. So you start with your breathing and then you move into changing your narrative. And you technically don't even need to know your whole history. It's helpful. It's very helpful to know, for instance, from Jamaica, this island has like a wealth of amazing things that come out of this island, right? And so it's helped me to be like, no, I come from power, right? But if you don't know that, you don't necessarily need to know that you didn't come from power. You can just retrain based on your own, the generational trauma is showing up in your life, right? So you just need to know what's happening in your life to take the next steps. And so there are treatments that you can do for it. The other thing is retraining your eyes is very important. So not only is your pupil dilation going to change, which that's not something that you need to be aware of, is like, oh, my pupil dilation is changing. But you need to be aware that the muscles in your eye aren't moving the same way that somebody who didn't have generational trauma, right? Mm-hmm. So if you are working on doing something like this, the first thing I would do is retrain my breathing. Then I would start to change the story. And as I'm changing the story, I would literally close my eyes and roll my eyes into the back of my head and all around. And when I feel a tension or black spot, to recognize what's in that black spot. There's something being stuck there, and the muscle is actually been kind of disconnected from working properly. And once you're able to do those things, then it would be more easily for you to kind of go, you know what, I'm stepping into the space, and I don't care if people say I'm Black, that's fine. It's they just don't know any better yet, but unless we make them move into these spaces, they'll never know, because they're not gonna see us there. So we have to get ourselves there, but we can't get ourselves there if we're constantly traumatized. And so you can just retrain you. And then if you know the background, which you do, that then can help too.
Yeah, thank you. So very informative. I recently took some training in EMDR. So I don't know if you know that approach to treating trauma. And of course, the basic protocol is using the eye movement. So I don't know if there's a correlation between what you just shared, but throughout the training, it was, still lack of evidence related to EMDR specifically treating people who have experienced trauma, in particular complex trauma and intergenerational trauma. So I don't know if there is a connection there.
Yeah, there is.
Yeah.
So with EMDR, it's helping you to process information. Your eye needs to make saccades. The saccades are shorter, but this modality is called brain spotting. And so if you're able to, it's just EMDR is usually done with your eyes open. Brain spotting you can do with your eyes closed. They will both work, but they will work on different things. So I think that's kind of the main process. And they also take different type of what I would call like seclusion, right? So for brain spotting, you can do it in your home, and you can just cry your eyes out, right? And that will heal half of it. Whereas EMDR, you kind of need someone to be doing this for you, and then you can just drive in a car and look out the window and think of something that will also give you EMDR, or you can go for long walks. Your eyes will make those saccades on their own during long walks as you're reprogramming. So it's just the difference in how you're going to do it. I would be doing both. So I would be going for walks and reprogramming my thoughts at the same time. But then there's also the ability to just like lay down in your bed. If it's something really deep, then you can't get out of, you can't get it out in that walk. Then you need to lay down and you need to fix it. And it has to be rewritten. You can't just leave it in the trauma. You can't just recall the trauma. It will reactivate your nervous system. You have to fix it and make a new plan. Okay, so now I see what happened. Your brain has to actually put everything in sequence, right? If you have black holes in your memory, or you have black holes in anything, it's actually, your brain has cut it out because it thinks it was so traumatic that it's just going to reactivate your stress response if it finds it, but it's not going to let you see it. It's sort of protective. So it's better if you pull it back up, fix it, and then your brain says, this was just an experience. And now you don't have a trauma response tied to it. So you could go into a room with people who look like they might be racist aggressors and just have a conversation without the nervous system. So you want to decouple them from each other.
Sorry, I just want to add, I've to go back there, I know that there was a period, I don't know if it's still being offered, but there was a EMDR in color, specifically for Black trauma. And so that's something you may want to look at. I don't know if it's still being offered. And I've heard about brain spotting as well, and that's something that I was even considering pursuing. And I think that that's the Afrocentric piece, is if it's an evidence-based protocol that works, that's based in science, we may just need to be a little creative in tailoring it to the people or to the needs of the particular population.
So the training that I took was based in somatic, so somatic-based EMDR.
Okay.
Which brought in that other narrative of using the body, and also looking at other ways to bilateral stimulation.
Okay.
If you're using that as an intervention. But thank you so much
That's awesome.
for sharing.
Thank you. Please go ahead, Dr. Ewing.
Good discussions. I just want to segue into a little bit about a workplace policy, the impact of workplace policies such as flexi work, telework on mental health. We know it may have two effects depending on what kind of being you are, what your social being, whether or not you like to be along with your colleagues and at work, or whether or not you prefer to be at home with your kids. So what are from your experience, what have been the mental health impact of workplace policies in the advent of COVID?
Personally, for me, I thought, I was quite happy to be allowed to work from home, I thought. And then realized that I really need my colleagues. I need to be face-to-face with people. And so, I think the ideal thing for me is flexibility. At times when there's a need, I can be far more effective when I can organize my workspace at home. But I guess it depends on the type of, I think that the best policy is one of flexibility, as long as people can be productive and supported to do their work. What I can say, I can share for me has been frustrating at times is when we were in crisis, if we're able to shift to, let's say working from home and doing things more remotely, and then let's say post-crisis, then all of a sudden it's just not an option. And then it as a staff member, it just becomes, it again goes back to morale and people get frustrated, right? If I can do it from here, why is it then important for me to sit, in a particular building? And I think that just has a bigger impact on how people feel. I can remember one workplace, which shall remain nameless, but the entire team was on a training, a virtual training. So for 8 hours, we were all going to sit in our offices with the doors closed and engage in the training. but working from home wasn't an option. It doesn't make any sense. We're not seeing any humans in person, and we're just here closing our doors, right? And so I think that, like, it's not a one-size-fits-all. I think as a manager, if you have individuals where there's concerns about productivity in that, then I think you manage that as you would any other. But I think for health professionals, I honestly believe people are actually work more when given the flexibility. They're more likely to pick up their phone at a time when, not like, for me, when I left work, the phone went off and it stayed at my desk and I continued. But then when I started to do work at home, I found people were just a little bit more productive, partially because if I needed to take a moment to do something personal, it wasn't like the end of the world, if I needed to, help my kids with homework or whatever the case may be. So I think it's important to, not treat the exception as the rule, because the fear is, everyone's going to be at home, hanging out, maybe not doing their work. But I think that that's a rarity, and that folks should manage those situations as they come up.
I think workplaces should provide the option. There should be flexibility, and it depends on the sector, of course. I remember when I had to teach from home for 3 semesters. It drove me crazy. I'm very social. I'm tactile. I have to walk around the classroom. I have ADHD somewhat, I think. Self-diagnosed. I just can't stay still. So I can't sit down for 3 hours in a lecture and, I gave so many breaks. I'm like, student, we have to take a break now. We have to take a break. So it depends on the sector, and it should be an option. Now I'm here. I am teaching remotely, and this is the first week of a new semester, and I'm going crazy not being able to see and touch my students. So I've given them assignments. They're mad with me, first week assignment. And I'm like, I can't wait to go back. I need to see. I'm social. I need to see and touch and walk around and interact. So it depends on the sector and it depends on the individual. But they should offer, workspaces should offer the option. Because certainly it helps. Like now it's helping me. I still earn, still get paid. But yeah, it depends, I think. But it ought to be an option, ought to be considered. It makes sense. Just a quick example, my son is in IT. He works from home almost 99% of the time. That personality that he has, perfect for him. He's not social, he doesn't even like to be out in public. So it works for him, and it works for the industry that he works in. So again, it depends.
I would agree. I think there should be an option, and even, I know I always go back to this is how the brain works, but there are periods of time for socialization, and there are periods of time where people need to just focus. And at times, when I need to focus, I don't want people coming up to me with a glass of coffee in their hand, just chit-chat. And I know it's not a nice thing to say, but I'm deep in focus, and I can get this work done in 25 minutes if you stop interrupting me, right? And if I remove myself from the situation, that's really easy to do. And then in the meantime, because I've gotten my work done faster and because I'm at home on that specific day, I can put my stuff in a washing machine, or I can, get something else done in that time, or I can put a pot on the stove while I'm typing. And so I can get 2 things done, but if you separate my life, I just feel that a lot of times it's as if, this is who I am at work and this is who I am at home, and they're not allowed to cross-talk. And for some reason, if I put something on the stove while I'm at home, I am a failure, even though I did 3 people's jobs faster than 1 person could, So I think if we offer people the flexibility, they can then see, okay, today's a day where I do need to talk to people. Maybe I've acquired so much information, or I've gotten so much done, I'm stuck, and now I need to go and talk to people face to face, so I can say, okay, well, what's the next step? Because here's what I figured out. We collaborate, and then I go back and I can switch my brain back into the other mode. And maybe my brain goes into different modes because I work differently than other people. I don't know, right? But I think that's what works for me. So if that's what works for me, then why shouldn't I be allowed to do it when I need to? Instead, what used to happen, what I would find in the workplace was you have to come and you have to sit at this desk for 8 hours a day. And you can't even leave to eat. First of all, you have to bring a lunch or pay out of your pocket So I make you come here. I lose an hour driving there, and then I have to sit at this desk, and then people are interrupting me with my work all day. And then in that time, I maybe didn't have time to make my lunch, so now I'm buying lunch. That comes out of the money I just made. So then, okay, so now I have to go buy lunch. I don't know what was in that lunch. It's not as healthy as it was initially, because if I'm at home, I'm still doing my work while there's some really healthy food on the stove. So, you know, it just depends on how we want to look at it, I think. So I think if somebody can't get their work done properly, then I think that there's probably some sort of ADHD involved and some sort of, we would go back to the talk about mental health, I think.
Thank you. Go ahead, Mrs. Carnegie.
Thank you so much. Okay, so healthcare, I'm a nurse. I did share before about burnout, and it's not one of those professions where you have the choice of working from home because you need to be in touch with your patients. We have a crisis, mental health crisis among caregivers that are not readily recognized. And one of the reasons why I'm really happy for this conference, if I may say so myself, is because we get to shine the spotlight on mental health, but we want to include healthcare givers as well. We have physicians and nurses committing suicide. We have physicians and nurses leaving the profession. And I don't really want to get into my own presentation too much, but I'm not a mental health expert. So the question I have is, what recommendations would you give? My personal opinion is, when you see burnout, it's already too late, because it means the body's no longer able to adjust to the stress that you're under. So what are some of the things that healthcare workers can look out for when they say, okay, I need to take a rest now and not wait until? Okay, so yeah, what are some of the things they can look out for?
A lot. I mean, the physical signs, right? So bloating. So if you see bloating in your ankles, bloating in your hands, if you wake up with pain in your hands, that's inflammation that's already started in your body. Just to know what the signs of inflammation are. So on the back end of mental health is inflammation. And so if you become very inflamed, it's going to affect your brain, and then your brain is going to shut down, and so on and so forth. So some of the signs of inflammation are, if you're waking up with a lot of, there's no better, I don't know how else to say this, eye boogers, right? And you see that's a lot of inflammation that's coming out. Inflammation can only leave your body in a few ways. It's through the orifices, the holes of your body. It goes through a mucous membrane. And so, we're all in health here. So the smell of your poop is a very clear indicator. If it smells like mucus, you are going towards a decline, right? So it's really understanding, when is my body looking inflamed? And then knowing I have to, okay, stop. And move on to, have I drank enough water today? Did I do the types of things that I needed to do to decrease the inflammation? And second of all, if I'm overworking myself to the point where I can't, I didn't even notice that I got to burnout, then what story do I need to rewrite about myself that's making me get up every single day and put everybody else before me? And that falls in the category of people pleasing and altruism. There is a portion of helping people that's necessary, but I think everything relies on a continuum. It's like an equalizer, right? So if you take this and you slide it completely over here and you're at the bottom, then what's the point? You can't help people anyway, right? So I think you need to recognize inflammation. And then the second thing that I was going to say in this category is gone from my brain. So maybe I'll remember later, but and it's now gone, so maybe later.
I'll just add, I think also, and I think this should be peer-driven, but an opportunity for staff to check in with each other about how they are doing. And I say peer, it's important that I think this not become a performance issue. So if this conversation is happening maybe without management in the room, but where we can all sit down as colleagues, how are you feeling today, Duane? I'm feeling burnt out, and I don't want to see patient so-and-so because they're driving me crazy. Where you can have that conversation and not be worried that if Charlene's my supervisor and I'm going up for promotion, it's, well, Duane, you know, I need to be able to say I'm feeling a little exhausted. I didn't get much sleep, whatever. And I think that if we're doing that as peers, then there should be some kind of, you know, protocol where, Duane, for the last 6 shifts, you've said you're feeling burnt out. And it's about maybe encouragement and support. Not being mandated, but just as, you know, just kind of putting it out so that you're checking in. And I'll make this point as I think it is important to be mindful about whether or not I'm speaking from, like, let's say government or healthcare organization, that this not be a performance thing. I should be able to come into work and say, I really don't want to be here, but that not find itself into some paperwork later that suggests that I'm not dedicated to the job, because that thought doesn't mean I'm not going to move with integrity or follow my college guidelines. But I think once we create that safety around peers and we support each other, it'll be far more valuable if another social worker says to me, hey, Duane, you know, you haven't been yourself. Like, have you taken time off? Have you thought of counseling? And I think it just needs to be something that's regular. So I don't know, I know that the nurses I work with, we had a very similar discussion. So our healthcare teams are multidisciplinary. So nurses, occupational therapists, social work, psychologists, we're all in the same space in the mental health. But the nurses were used to get up in the morning, or first thing, and everyone gets their duties. Okay, you're doing this, you're doing that. So we just incorporated that into the brief morning meeting. Everyone would share what they're doing, and we'd go around the room. How are you feeling? And we made it a point that anybody who's feeling a little bit, you know, in need will be the one to kind of share, like, yeah, I was here till 6 p.m. yesterday, I'm feeling really exhausted. It also allowed for us to support each other. So to say, you know, hey, Charlene, I can take on that work. You need to get something done, or you need to get something done for 25 minutes. I know I'm the person who always goes to people's offices. So then I would agree that, okay, I'm gonna, like, let you take that time to do that documentation. But I think that that's one of the biggest piece is among peers, just having regular conversations to see how people are doing, and then the encouragement for support. I think it's more valuable when it's among your peers, and doesn't, hopefully, if you're having those conversations regularly, it's dealing with a bit of that stigma, and maybe that ego can go down a bit because we're talking about it all of the time.
I think I read, and I don't know if you know of this, Duane, recently, I don't remember the publication, but burnout is considered now maybe a health issue, and I think it's being recognized as a health issue. And I think the idea is to be proactive, take care of your individual self. We talk about, Duane and I, we facilitate a workshop on self-care. You don't need your boss, you don't need to pop down before you know that you're burning out. You can tell the signs of burnout. She talks about the physical signs. You can tell, you feel overwhelmed, you're doing too much. Like I said, 2-day turnaround to grade over 100 exams, papers, it's just too much. It was too much for me. So this is something I'm gonna take to the dean when I get back, that we can't be asked to turn around grades in 2 days. It's impossible, you know, and to give people quality education. So I think it's the onus is on the individual and, of course, on the organization to know when burnout is drawing near, and to know that people can openly say, hey, I'm not feeling well, and it doesn't show up on your evaluation. Like, 5 days last year, you said you were not feeling well. What's happening? And I'll tell you, working in North America, we're scared to even say we're not well. If I have a cold, it's the sniffles. I don't want to even say I have a cold, you know, because you feel that it's going to come back and haunt you. So again, people have to be able to say, I'm not feeling well, and it has to be regarded as something to look into, because we are all overwhelmed. We all work more than we need to, I think, sometimes. Okay.
I actually remember what I was going to say. You can also...
Your brain is back.
Yeah, it was actually some of what you guys said that I was like, yeah, that's what I was going to say too. You can make a personal energy map. So I think every individual should do this for themselves and understand, okay, if I need 8 hours of sleep and I need to eat X amount of healthy food, what's required for me to get that so that I maintain that every single day? If I need to ensure that my emotions are come full circle, that means I might need to call somebody on the phone every once in a while. That might mean I need to journal it out, and I need to dedicate 30 minutes a day to journaling it out, or whatever your way of getting your needs met. You make a personal energy map. And then from there, you can kind of work backwards and then work on that, right? But I think to say I put work above me and my own health and everything else is not sustainable. It's not, I mean, you can only do it for so long before eventually you'll drop dead and then they have to find a new employee, right? So it benefits them for you to be sustained. And so I think those things.
And just remember that none of us is indispensable. They can always replace us.
That's what I thought when you said that. You dropped dead, and it's not that they can't, they'll replace you.
They'll find someone else.
I
right?
left my job of 15 years, and yeah, they were calling, come back, haven't heard a peep. About 4 weeks, they're fine.
It's going to cost them a lot of money, though, right?
Yeah.
So they have to hire someone else. They've got to get a new benefits plan. They've got to have somebody put in place the new benefits plan. And all of that time, they could have just nurtured you a little bit more. You know, it's like all you had to do was understand that I'm a human and I'm not some piece of robot, right? Yeah. So if we can just integrate humanity, like, you know, more Ubuntu into the workplace, I think it's necessary.
Thank you. You know, a part of the discussion that came up, which I found very interesting, and it stimulated a memory. I remember during my last burnout, because at first I didn't understand what was going on, so I was getting all these tests done and seeing different specialists, etc. And I shared this with my then it was weird because I was the director of education. So I reported directly to the corporate office, but I was under the supervision of this lady. But the lady here couldn't fire me. You know, she could always write me up, but she had no authority to fire me. That would have to come from corporate. However, I had a conversation with her when I was seeing my doctors, and she said, just ask the doctors to put certain things on paper and bring it in, and we'll give you a couple of days off. So I went back to my doctor, and my doctor said, absolutely not. The doctor said, I have seen where they've asked for this, and they've used it against you. So there's now the mistrust with employers and employees. So once again, I really liked the question that came earlier, what if your supervisor is having mental health issues? Because I think anyone who would want to deliberately hurt another person's reputation or put their careers on the line must have some mental health issues. I remember a supervisor, my CEO, actually, who said to me once, you're going to have to learn to manage your manager. I figured that out. It's not really managing your manager because I no longer subscribe to managing people. I manage my tasks and my situation, and you deal with it however you do. And I give God thanks to my burnouts now because they've taught me a lot about mental health, managing myself rather than managing other persons. However, the question still that I would love to ask is, from mental health professionals, how would you encourage someone who feels that they cannot trust their supervisors to communicate with them when there is even the semblance of power over a person's job exists? Because there's a lot of fears. For example, for this conference, a lot of persons were afraid to ask for time off to come to the conference. So how can you encourage a person in a situation similar to this?
I might be the worst person to share. I would say personally, and this is from my experience, if you don't trust them, then don't trust them, right? And so what I mean is protect your information. So and this goes back to that diagnosis question, right? Is it important to know what I'm diagnosed with, or is it important to know that my physician says I cannot be at work? If the physician has those letters after their name, they are qualified to make the assessment that I should not be at work. And so I always, when I'm dealing with people who are asking for letters for time off or burnout, like, I will share nothing. I'm a registered social worker, and so should take the next 2 weeks off or should work from home or whatever the case may be. The information as to why the person making that decision does not need to they don't need to know that in order to do their job. They need to know if a medical professional is saying that you should not be there. And so I think that you should protect your information. And if you have a feeling that that people can't be trusted with your information, trust that feeling and protect yourself. And I would go as further as to say, don't be bullied into sharing more information, because unless that person is going to do something with that information, like is qualified to do something, like, if it's treatment, if I'm a therapist, I might need to know that it's depression in order to consider. But you don't need to know the specifics of what's going on in order to grant someone time off or whatever the case may be. And so I think that it should be, and as an employer, I get it. Like, if you're a manager and what do I do? Someone just says the person's off. But if I know that you're engaged with that health professional, I'm going to trust that that registered professional is doing their job and is not risking their license to get you a few days off work, right? And so that's my piece. I think that you should protect your information because, and I don't even think it's always, sometimes it is from a place of someone wanting to harm you or whatever, but I think in my role as a mental health individual in a prison, I'm a liaison between the mental health team and a correctional officer. So going back to my example, does a correctional officer need to know that someone is diagnosed with schizophrenia? No, that doesn't give you any information. It's just a diagnosis. Many people suffer from schizophrenia and function quite well, have jobs, pay their rent. But is it helpful for that person to know that if the individual experiences command hallucinations, that is a risk factor? Yeah, so I'll give you that information. This is what you're looking for. So more signs and symptoms. So if you're getting information for your employer, very minimal. Yeah, I'm working with this person. I think that they would benefit from a reduced work. We're currently engaged in treatment or whatever the case may be. Unless your supervisor is going to be giving you therapy or actually needs that information in order to offer something other than giving you time off, I think you need to protect your health information, because I don't know that we can trust everybody to use that. Similarly, you could give me someone's blood work, and as someone who's not a nurse, it means nothing to me. There's no value in it, right? And I think that the same, like, let the people who need that information use it.
So my background is in HR a little as well, I did some training in HR. Well, my master's is actually in HR, but I did more training, and I teach HR, and one of the areas that I focus on in HR is policies and handbooks and, all these scripted things that never change. They need to be revamped. We need to get them into the 21st century and understand that health is changing, as the wonderful nurse lady. Health is changing, and people's information is important, and privacy and all of that. I don't think they need to know everything. I agree with Duane. What value does it have whether you are diagnosed with something or not? You need to take some time off, right? And you need to understand that if people are not well, they're just not well. Some people will lie, but People always lie. How are you going to stop that? How are you going to manage that? Or how are you going to gauge that? I think it's really a matter of policies and revamping old, stale, outdated policies and just bring them into the 21st century. And make them realistic too, just make things realistic.
I said this a little bit yesterday, reading negotiation books. So you're dealing with a terrorist, right? Right? It's like, not to put it in that exact terms, but that's what these books are geared towards, getting people out of hostage situations, right? And so it's really about talking to people who are irrational, and who are using their background of maybe being taken advantage of in the past and projecting that onto you, which is not the case for you, right? And maybe it is the case, but that doesn't mean that you need a break. You don't need a break, right? And so I think really understanding how to communicate with people in a specific way, and that comes a lot from those types of books, right? If somebody's irrational, it doesn't seem logical, but you ask them irrational questions back. And so it is true. And so I think, educating oneself on how to communicate with somebody who's not doing well is really important, because that person is not doing well. So if you put up a defense mechanism against them, they're going to get defensive again back, right? So you need to know how to talk to that person. And then the second thing, what's wrong with my brain today? It's gone again.
Lots of great work.
Yeah. Talking to people who put you in bad situations. I'll leave it there. If I remember. There was one other point, but I don't know. I don't remember.
I think it will come back after lunch.
Just hungry.
Thank you very much. You have been sharing quite a bit. But one thing I would like to add, though, is I have a background in language communication, and I have also worked in HR. And I realized that when I was much younger and going for job interviews, one of the main questions that would be on the job interview is, how do you resolve conflict? I was not trained in conflict resolution when I was doing my BA at the university. So every time I went to an interview, it's either I think I'd flunk on that one until I started researching sufficiently on what is conflict resolution, how do you resolve conflict. And I believe that HR in any organization should ensure that we have persons trained in conflict resolution so that we understand, not just persons in HR dealing with issues that come before them, but every member of staff should be trained on how to resolve conflict, and especially dealing with very difficult people, because you don't know the personality of every person with whom you're interacting. So understanding how to do the basic conflict resolution, I believe, is very important. I remember this is the head of an organization. When I went to this organization, I was told that, or when I was going in, I was told that there's a lot of work to be done. There's a ton load of work, and we need it to be done so that the department can be freed up. I got it done in a very short period of time. I was told by a member of staff, you're working too fast. You need to leave some of the work on the desk so that they can see.
You're doing too good of a job.
That's right. I need to leave some of the work on the desk so that they can see that I have things to do. I'm just moving too fast. And it so happens that there's a backlog department at this organization. Backlog department. Really? And I'm there moving too fast, so I'm clearing the backlog that is there, and so that's a problem. So some people seem to like, and that's one of the reasons why I raised the question about what happens when the person at the helm, the leader, the manager, seems to be having issues. Because you can't be complaining if I'm clearing the desk, if I'm making things fluid so that things can progress within your organization, right? Now, somebody like me, as was described by that particular head, I'm a thorn in their flesh. Now, for a for the head of an organization to say that to an employee who is being very effective and efficient, no, I think that, you discussed Bellevue, but I would not just put her there. I believe, first of all, she should go through psychological evaluation and be assessed so that she knows how to deal with her staff members who are doing something different, something that does not seem like the norm within the organization. Because I think, just like was discussed earlier, the need for change is necessary. Give me a chance, let me do the change, and let's see something progressive happen. I see everyone earnestly waiting to present, to make a comment, and I'm welcoming your comments.
Well, first of all, you're trying to close down the backlog department. And that department exists for a reason.
Or just reassign them. Why can't they be the proactive department?
I know,
right?
exactly.
Why are we always stuck in this backlog?
That's the thing. That's the culture. So that organization obviously has a culture where clearing backlog is not allowed because, right? They have the department.
You need to update the framework.
Yes.
Completely
So again,
update the framework.
speak about policies
Insurrection, that's what
and
it was
changing
called.
things, and shifting. But I think it's just the complexity of working with humans, and you meet upon some people who are not so easy to work with, some are easy. And I talk about organization culture a lot in my teaching. I actually teach a course that's titled Change in Organization, and a big part of it is organization culture. So again, organization culture. It has to be looked at, it has to be re-examined, and there has to be a shift sometimes, or some of those departments would not exist.
Thank you.
I guess I gotta qualify this. I guess it depends on what type of a work environment. So I'm speaking from, I guess, either when I think of places I've worked, either a government sort of structure with a manager or a hospital structure, which hospitals more towards the private. I think we need to just, and I don't know your situation, so not to minimize it, however, I think we need to be mindful about how we address poor leadership. Someone who's a bad manager, if we immediately equate it to maybe it's a mental health issue, this is the stigma. It could be, but it could not be. And until they're assessed by a mental health professional, we don't know. So maybe they're a poor leader. Maybe they don't communicate well. Maybe they're not skilled at leading people. You should be able to not recognizing talent of staff who are being proactive and working too much. And I think it's important, just like how we are, to be consistent, just like I'm saying we should protect our information, and I don't think it's fair if a manager were to say, Duane is performing poor, he probably should be in a hospital. I think we should have the same consistency when it comes to mental health of our leaders, but I don't know is there a way to assess that leader, right? So what I can say from places I've worked is there's criteria of, doing the job, even as the chief of mental health, right? And so maybe I'm spoiled, but most of my workplaces were unionized environments. So if the manager is not following policy A, then you could go to the union, and surprise, I was the union member who was having fights with management, but then it becomes very black and white as, is this how we communicate with staff? Could be mental health, may not be mental health. I think we should also not consider that there are just some people who are just not nice. Like, let's go back to just poor leaders. I think that's poor leadership. I think you shouldn't be in a position of leadership if you're, even just communicating, you're the thorn in your side. You could think that, but to communicate that to someone who's under you is a demonstration of poor leadership. So what I would say is, is there a structure? Is there someone above that person, right? And is there a process where, at the end of the day, if you're not a good leader, your staff won't follow you. So you'll have more and more issues, more and more poor morale, more and more situations of people not wanting to. And I think even if that could be, if there's a way to bring that forward to whoever else, or to that person, because maybe that's the only option, right? If you have someone there at the top, you know, but if they want the organization to run well, it's not helpful to put down your staff member who's working hard. So complicated, but I'm curious, like those are the types of things I'm very protective of jumping to or labeling it as mental health, because the more and more we do that, we continue to have the negative connotation with mental health, which may be it, but it could also just be lack of skills for managing it. You get what I'm saying? Like, because the diagnosis, again, it doesn't give you anything. Because some people, you know, maybe have, you know, low self-esteem or very poor egos, but maybe have done the work, the brain work, and have learned how to manage that. So having the label of what the issue is not really, you know what I mean? It's not really the answer. It's how are you coping with it? And if you're in a position of leadership, how is it impacting the people, you know what I mean, around you? Yeah, complicated.
I actually remembered.
Awesome.
So,
Go
but
ahead,
it was
please.
also through this, right? So, I think that if you do your best to communicate and it's not working, then what's keeping you at that specific job, right? There's some times where your energy just doesn't match the people around you, and if that's the case, it would be better for you to find a place where your energy does match, and then you can collectively do something there, versus trying to change everybody around you into something that they're not willing to try. So if you've tried to communicate and it doesn't work, then, you know, should you inflict pain upon yourself and stay? I think that would depend on potentially how you grew up and what you believe about work. So, yeah.
Sorry, can I add one more thing as well? I think as managers or people who run these organizations, it would be helpful to invest in an outside conflict management resource, so that the people who are looking at it maybe aren't getting sucked into the politics, like not, well, we'll hire Duane to be the conflict manager who's hoping to be the manager next time, and then there's not that trust. Like a small investment in someone who's completely outside, who everyone meets for the first time, who is, like, as you say, trained in conflict management, but who is comfortable giving their opinion and won't fall into any of the other issues. I think that would also be helpful, because I think there's probably more likelihood that both sides may feel that they're neutral. Hopefully they're neutral. And there's got to be some way to encourage to navigate the power structure, because just because you have that neutral person who has, let's say, an opinion, whoever has the power still needs to, like, are you going to follow through on it, or is it just, well, we'll just ignore that part of the report because, you know, we don't agree with it. So I think outside body, I think it's helpful to have people on site trained in conflict management, but I think it's also very helpful to have a neutral, someone who doesn't know all of the ins and outs of, you know, the individual stories of, you know, what's going on.
I think at the end of the day, you don't have the same vision of the future. So the vision of the person that you're in conflict with and you are not seeing the future in the same way. And what is hard for people to do is to communicate through the fact that their vision could maybe merge with somebody else's. And their vision is a protective mechanism. Their vision is keeping them alive, you know? And so why is that vision even keeping them alive? And then, you know, maybe you have a third party come in because they don't have either of the visions. And then maybe the vision becomes better because the two of you are working together. So.